Hello, this is the History for All Ages channel, and today we are going to be looking at the medical renaissance in England between 1500 to 1700. The first thing we are going to look at today is the scientific approach to diagnosing disease and illness. The rise in humanism in England during the Renaissance led to an increase in people opening their minds to new ideas, not only in the traditional sense but also the medical sense. People were more open to criticize the four humours theory, as people were starting to reject the view that God created disease as a punishment. People also started to experiment more in the medical field, mainly due to the church's decreasing authority in everyday life. The work of people like Vesalius made this possible, as he discovered some of Galen's theories were wrong. We will talk about this in more detail in a later video. The next thing we need to talk about is a key individual in this course. This is of course Thomas Sydenham. Thomas Sydenham was a physician from London active in the 1660s and 72s. He is famous for his refusal to work solely based on previous theories. He actively promoted the idea that observing patients over a period of time and noting down all of the findings was the best way to find out what was wrong with the patient. He also believed that you should treat the disease rather than the symptom, which was the norm at this time. Thomas Sydenham also helped treat malaria with cinchona, which is still used today. He also was a top physician who was not actually prescribing things like sweating to get rid of a disease. Instead, he prescribed more rest, like sleeping in a cool bedroom and drinking cold drinks. One of his most famous discoveries was that scarlet fever and measles were completely different diseases. He unfortunately did not have the capability or materials to actually identify and isolate different microorganisms. But he did help pave the way for more modern scientific discoveries. The last thing we need to look at in today's video is the improvements of communication during this period and how this helped the medical profession. The printing press was created in the 1400s in Germany. It was so popular that by the 1500s there were hundreds of them in a variety of countries throughout Europe. Printing presses were quite large. They made it a lot easier to send out information around the country faster and more accurately. It also allowed for books to be copied and distributed, as it was not necessary to write books out by hand. So this increased the number of books in circulation at the time, which goes hand in hand with the rate of literacy going up at this time, as more people had access to books. It also took out a lot of inconsistencies in books, as it was copied out the exact same. Whereas when books were handwritten, it was easy to make a mistake or change grammar, or even some words in copies. The printing press also took the role of book copying away from the church, which again led to a larger range of material being released and a lot more information spread that the church would not necessarily agree with and thus would not have been published before the invention of the printing press. The last thing that helped with communication at this time was the creation of the Royal Society. The Royal Society was set up in 1660 to allow for scientists and physicians to talk about their ideas and inventions. They encouraged the use of experiments and debate. Charles II of England gave this society the Royal Charter in 1662, which gave them a boost in credibility. The Philosophical Transactions Journal was created in 1665 to publish some of these scientific theories and discoveries. It was the first scientific journal which still exists today. The Society also took part in funding translations of other European texts. to help widen the variety of material for scientists to use. This and the printing press made scientific knowledge more accessible and helped future discoveries possible. This is the end of today's video. I hope you enjoyed it. Please subscribe, like, and share this video.